Good morning everyone. I am Dr. Akhil Vijayan, Consultant General and Laparoscopic Surgeon of Smita Memorial Hospital. Today we will be clearing your doubts regarding varicose veins and its new methods of treatments. Varicose veins is a curse faced by humans because of their erect posture. Since we are walking on two legs, we are walking against gravity, we are actually having the problem of varicose vein. If you look at four-legged animals like quadrupeds, they won't have any varicose vein. The problem is that the humans' lower legs have two systems of superficial veins. They are the long saphenous vein and short systems of vein. So once varicose veins are classified as veins which are dilated more than 3 millimeters in size and which are typically characterized by reflux of blood flow. That means blood is flowing back through the veins and it is characterized by intermittent blowouts. That means the veins are swollen like balloons. So varicose, not all veins are varicose vein. If you have a small dilated vein, it is not a varicose vein. We can actually characterize the vein if it is having a reflux of blood flow and a intermittent or blowout. Then it will be called as a varicose vein. For most of the people, they won't have actually any complaint regarding the vein or any complaint regarding walking around. Most of the people will be complaining about a dilated vein or a large enlarged twisted vein. For some people, there will be severe heaviness of the legs, muscle cramps, blackish discoloration of skin. They will have swelling. They will be the legs will be normal in the morning, but by evening they will have a big swelling in the foot. And some people might have difficulty after sitting for a long time or walking around for a long time. They will be complaining of severe pain. And some will have itching also. Once the vein starts to create problems for you, or if it is cosmetically it looks really large or dilated, or when you develop a pain of the leg, muscle cramps which is excruciating, if there is a black discoloration of the foot, if some wound is there in your foot which is non-healing, and if rupture of the vein occurs, when once you get a vein which is bleeding out and you can't control the bleeds, you will have to go for a medical help. Previously what we used to do was a surgical procedure actually, which was done under general or spinal anesthesia. What we used to do that we used to make a 5 to 7 centimeter incision and we used to identify all the small branches at the inguinal or upper thigh region, and we used to strip down this long saphenous vein from the knee to the thigh. It's actually a long procedure, and the problem is that the incision will be larger, there will be much more pain, bleeding, and the hospital stay of the patient will be around a week, and they can only return to work actually after 1 or 2 weeks. Now what most of the centers you do is endovascular or endovenous procedures. That means the procedure is done through the vein itself. By using a small prick, we can insert a catheter like we used to do angiogram for the heart. We will do a prick and we will catheterize the entire vein, and the vein is actually ablated using either a radiofrequency ablation or a laser or using a venous glue. The vein will be completely obstructed or ablated so that it is equivalent to surgical removal of the vein. So the vein will not grow back again once it is completely destroyed. That is the new methods of the treatment actually. Actually RFA is an office-based procedure. Even an admission or there is no need for admission and no need for hospital stay. Once the procedure is done, actually the patient can walk out of the procedure bed into their rooms or their chairs. They can walk around, they can do their routine activities. No rest is needed actually. They can, once the patient is walking around and everything is okay, they will be observed for a few hours, and after that they can go back to their normal daily routine, or they can resume their work from the next day itself. It is done by a small prick only. There will not be, the pain of the prick will be there, other than that nothing will be there. There is no marks left behind, only a small prick will be there. No incisions are required for RFA. After the procedure, we will follow up the patient follow up after 2 weeks to see whether there is any bleeding or a dilated vein remaining in the leg, or if the ulcer is healing. If the patient is having a large ulcer, we have to see the progress of the ulcer, how it is healing, how it is getting normal, and if the color and swelling of the pain has subsided and all, we will follow up the patient after 2 weeks, and then maybe 1 month after 2 or 3 months. Then, so varicose veins actually is a not at all a serious medical condition. It can be completely cured. Even if you have a large venous ulcer in the foot, it can be completely healed if you do the varicose veins procedure or ablation properly. So there is nothing to be scared of. Actually, there is no major surgery, no major anesthesia. What we are doing is we are inserting a small catheter into the vein and ablating the vein. The procedure will be finished in almost like 1 hour, maximum by 1 hour, and you can return back to walking and your normal activities by 2 hours. You will be observed for 2 hours, and you can go home on that day itself, and you can resume your work from the next day onwards. There is nothing to be scared of. This is one of the most modern RFA machines in India, which is available in most of the high-end hospitals in India. This is a RFA machine made by Covidian, and you can see here this is the RFA catheter which we insert into the vein of the patient. This tip, if you can observe closely, you can see the RFA heating coil, and you can see the thermometer in the tip of the heating coil. Once we press this switch, the heating coil produces the radio frequencies and they ablate the segment of the vein, and we can sense the temperature inside the body by the thermometer, and you can see the thermometer temperature inside the body in this screen of the machine. That's how we actually do a segmental ablation of the veins.